Welcome back to the Morning Blend. March is Colon Cancer Awareness Month, and there are a lot of myths about the gold standard for detecting colon cancer, which is, of course, a colonoscopy.
Here to clear up the confusion is Dr. Erica Samuel. She's from GI Associates. Welcome back.
Thank you so much for having me today.
Yeah. You know, I think it's interesting because colon cancer is one of the cancers that is preventable if caught early, right?
That is
or
very
if tested
true.
For early.
Absolutely. And the scary part about colon cancer is that when people have it, they often don't have symptoms until it's too late.
Yeah.
Yeah, that is. So really a colonoscopy is a gold standard in terms of detecting it and picking it up early, like Tiff just mentioned.
Absolutely. There's really not a lot that compares to that direct visualization of the colon.
And sometimes you can see things and do something about things that aren't cancer, but they're things like polyps, where removing them helps your long-term prognosis, right?
Absolutely. It's pretty incredible. Some studies show up to 40 to 50% of people will have polyps at some point during their life. And if we can remove those and prevent colon cancer, it's really quite remarkable.
Are polyps a precursor to cancer oftentimes?
Yes, there are different kinds of polyps, but the ones that we are concerned about are adenomas, and those go on to cause colon cancer.
So who needs a colonoscopy? What is the rule of thumb on timing or age or family history?
Yeah, in general, it was always said when you're 50, you get your colonoscopy, but that's moving. We're noticing cancers in younger people more frequently, and now we're recommending colonoscopies at the age of 45.
Wow.
And we're starting to see, insurance companies catch up with that as well, which is great.
Good.
But certainly if there is a family history, you should get in earlier. Even 10 years before the first affected family member is a good rule of thumb to go by.
And I think we've got to do our part in using some of these easy screenings, especially because insurance, like you said, is catching up and will pay for it. So those are things like mammograms, prostate cancer screening, as well as colonoscopies. And I want to talk about colonoscopies because I think mammograms are no big deal. Sometimes they're uncomfortable. Colonoscopies, I had my first one because my doctor said at 50 you got to have it. People always talk about the prep being horrible, but the procedure you don't remember. It's totally comfortable. No, for me, no pain of any kind afterward. But let's talk about the prep because I think that's what makes people nervous.
Yes, I can't tell you how many times I have patients come in though and say, wow, I can't believe I worried about that. It really wasn't that big of a deal. A lot of people use the sports-based drinks that are the prep. So we add medication to your favorite sports drink. And that's how you prep for the procedure. Yes, it's a night that you're going to be cleaning your colon out, but it's not as bad as the terrible tasting preps we used to have, and the preps are much smaller volume than they have ever been before.
That's a huge thing. My parents used to drink, I don't know if it was a gallon or maybe even more, but drinking a gallon of liquid for most people is a whole lot. It is a lot less now. I didn't think the taste was great. I thought it was pretty bad, but you can get through it, especially if you can mix it with something that tastes better.
Yes, absolutely. There are, the preps I think are better now than they ever have been before.
And I think cleaning out your colon's kind of a cool feeling.
Yeah.
You feel like clean. Yeah.
I hear that a lot of times.
You should do one on air.
Yeah, should I?
You should.
Okay, good idea. How about you do it?
I suppose I'm next, right? What about a referral? Because a lot of people will say, well, okay, I need to do this. I don't know how insurance works. Do I have to be referred to someone like yourself?
For a colonoscopy, you can just pick up the phone and call us. Okay. Everyone needs one at some point in their life.
Okay, now I was surprised because I had a grandparent die of colon cancer and my parents have both had polyps. Mine was totally clean and my doctor said you don't have to come back for another 10 years. Is it okay to trust that or should you think about maybe doing one every 5 after you're 50? What are your thoughts about that?
Yeah, I think it's really important to talk to your doctor about it. It has a lot of moving factors. That's how old your grandparent was. If you have more than one secondary family member, a first-degree family member, there's a lot of pieces to it. So, really just talking to your doctor is the best thing for you.
Okay.
Are there alternative options and like people have heard of like Cologuard and different things like that?
Yeah, that's a tricky question. So I, personally.
What is that, like pooping in a box?
Yeah, that's what our patients call it, the poop in the box, and you send it in.
We're talking about colonoscopy, so hey.
The problem with the poop in the box test is that it's not 100%. Actually, there's a lot of false positives, a lot of false negatives.
That's crappy.
It is crappy. I've seen people who have polyps or even cancers diagnosed after they've had a negative Cologuard, and the test itself is a little tricky. They don't report out the test as what it is. It's a positive test, even though they look for two things, blood in the stool or the DNA that's associated with advanced polyps or colon cancers. But you'll never know which one was positive in the test.
So don't go that route.
You know, I would recommend against it, and it's better for your pocketbook too to not do that way, because once you've taken that test and have a positive, your colonoscopy is no longer screening to the insurance companies.
Hello.
And there's a lot of money that comes out of pocket or against your deductible for that colonoscopy that's needed then.
Wow. So much important information here. I don't usually like to brag, but I do want to say that my doctor said I did an excellent job of cleaning out my colon before my procedure. I'm just saying. Okay.
Your colon's so pretty.
It is. I got a good looking colon. Thank you so much. This is really important. And we're laughing, but this is obviously a very serious topic. But we want to take away the scare factor. And the stigma of it.
It doesn't stink.
Get your colonoscopy today. GI Associates, this is what's wonderful. They are conveniently located. They've got surgical centers that provide access to the most cost-effective colonoscopy procedures in our area, and they're from Milwaukee to Lake Country. They continue south to Racine, Kenosha, and Mukwonago. So call for an appointment, 414-454-0600, or you can go to giassociates.com to learn more.
Where are you? Which location?
Yeah, I'm based out in Oconomowoc and Brookfield, and at our Mayfair office as well.
Okay, people are going to want to see you.
I know they are. They're going to be like, she's fun. She's that book in the box.
Thank you so much.
Thank you.
Appreciate being here.